Thank you, Mr. Chairman, very much. The Clean Air Act mandates that we protect public health from known threats based on science, and the science is clear that the current ozone level should be lowered. Whenever it becomes clear that new actions are needed to protect public health, opponents of the actions use the same old arguments. Before the 2008 ozone standard was finalized, we heard that this standard would cripple the economy, but this was just not true. In Massachusetts, both air quality and our GDP increased even as the ozone standard tightened, and our GDP increased significantly. A new ozone standard will require changes in some industries, but America is a country of problem solvers, and pollution is a problem that we can solve. And as a state downwind of most of the rest of the country, it is critical that we have national standards that create solutions to a national problem. Massachusetts can't solve the problem alone. So my first question then is to you, Dr. Diet. There were 20 studies cited in your testimony on the health hazards of ozone, all published in an 8-year time frame, and all adding to the mounting justification that the current ozone standard must be lowered to protect public health. Given the pace of scientific research on the health impacts of pollutants, do you believe that changing the assessment period of a new standard from every 5 years to every 10 years would have a negative impact on public health protections?
Well, thank you. I think it sure could. I mean, it depends upon which pollutant we're talking about or which substance in general, right? But you're right that the science does change, and I think that we should reevaluate what the science tells us periodically. If we allow a whole decade to go by, that may be too long.
Mr. Green, you said that with adequate compliance times and good partnerships amongst government agencies and the business community, that Sacramento is on track to meet the ozone standards within your compliance timeframe. Under the pressures of our national ozone standards, your region has made significant progress cleaning up its smog problem, even with the unusual population and geographic challenges that promote ozone buildup. Do you agree that waiting until a past standard has been met to set a new standard would weaken the momentum of clean air innovation?
I think the biggest place that is going to impact is that in our area, 80% of the pollution comes from mobile sources. And that occurs more and more as we get further into the ozone problem around the nation. So what you're doing is you're not only impacting people's health around the nation where they should be protected by the Clean Air Act, but you're also slowing down other regulations on vehicles, planes, trains, and automobiles, for example, that would help those areas that are in non-attainment.
Okay, so Dr. Diet, come back to you if I could. The National Ozone Standard has real-world impacts on the health of kids, of workers across our country, hospitalization, even deaths caused by ozone pollution. If the ozone standard were set at 60 parts per billion, do you believe that a significant number of deaths and life-threatening respiratory events could be avoided?
Well, I do. I think there's really good evidence for it, and both from the observation of what the evidence is that at very small increments of ozone that there are measurable increases in death rates from a variety of conditions. There's also, I could refer you to a very good article from Berman and colleagues that was in Environmental Health Perspectives in 2012, which provided an estimate of what would actually happen if everyone came into compliance with the 75 part per billion, which would also increase which would improve mortality, but that they showed successively greater benefits from dropping to 70 and to 60.
So, you know, in 1900, the average age of death in the United States was 48 years of age. So we had gone from the Garden of Eden to 1900, average age of death in the United States, 48 years. But then we began to implement public health policies. Clean air, clean water, safe meat, safe drinking water. And again, the meat industry didn't like it. They said it was going to hurt, kill jobs in the industry. But the truth is, whether it be the automotive industry or the meat industry, you name it, these new standards wound up extending life expectancy in the United States to 79 years of age, 31 years of bonus life that has been added to the average American just in the last 100 years with these public health interventions. What value do you put on that? Seeing your grandmother, seeing your grandfather live to an older age, knowing that young children now don't die from the things that used to cause death in our country. What value do you put on that? And yet we do it simultaneous with having a robust economy in our country, with unemployment actually going down right now, and it has been going down since we began the recovery from the economic collapse that was created completely unrelated to any clean air, clean water, safe drinking laws in our country. It was economic malfeasance on Wall Street that caused it. So in each one of these instances, what we've seen is that innovation develops, new catalytic converters, new ways of generating energy, new ways of solving the problem are developed once Americans are told that there is now a requirement that we must innovate. And I would say that this is just going to be one more instance where that occurs. I thank you, Mr. Chairman.